Welcome to the iLux2 training video. The iLux2 device is intended for the treatment of meibomian gland dysfunction, or MGD, which is the primary cause of evaporative dry eye disease. The root cause of MGD is blockage of the meibomian gland orifices. Please refer to the user manual for the indications for use and the full list of contraindications, precautions, warnings, and adverse events which can be found in sections 2 through 6. The iLux2 uses light energy to heat the eyelid and melt and express the blockages. Here are the components of the iLux2 system: the iLux2 instrument, the docking station, the AC power supply, and several types of tips. Attach the AC power supply to the docking station. Seat the instrument firmly into the docking station. Once properly seated, the base of the docking station glows blue and the display will indicate battery charging status. As the device is used, the battery icon will change from green to orange, then red, at which time a warning message appears requiring you to recharge the battery. Turn the instrument on by pressing the power button. It takes about 10 seconds for the iLux2 to boot up. When the instrument is ready, the screen will prompt you to attach a tip. The photo tip is a reusable rubber tip that allows you to stabilize the instrument on part of the patient's face while capturing a photo or video. Attach the photo tip. Be sure it attaches completely, with the side tabs snapping over the latches on each side. The photo tip does not need to be sterile, but it should be cleaned with an alcohol wipe once attached. Tapping the screen activates the camera, allowing you to take photos and videos. Tap the plus and minus icons on the screen to zoom in and out. White light is the default illumination. Change to infrared illumination by tapping here. Infrared is used for imaging the glands, which is also called meibography. Photos are captured by touching the camera icon. Videos are started and stopped by tapping the video icon. To view your images, go back to the home screen and select Gallery. You can zoom in and out using 2 fingers, or pan using 1 finger. To scroll, restore to normal zoom level first, then swipe left or right. You can also use the main switch to take photos and videos. A single flick of the main switch takes a still photo, while a longer flick will start a video and a second flick will stop it. To view the meibomian glands, the inner surface of the eyelid needs to be exposed. This can be done by pulling down the lid with a finger or cotton swab like this. Position and adjust the photo tip to get the best focus. When using infrared illumination for meibography, it's best to dim or turn off overhead lights to get the best images. When a photo is taken, the stored image is enhanced to highlight the gland structure. Remove the photo tip by squeezing both release buttons and pull off the tip. Be sure to wipe it with alcohol before placing it back in its container. The treatment tip, called a smart tip, is provided separately in a sterile tray. Attach a smart tip. Peel off the cover of the tray. Insert the snout of the instrument into the smart tip to snap it in place, then lift it out of the tray. Press the tip firmly towards the instrument using the thumb and index finger, taking care not to touch the sterile silicone cover. When the smart tip is properly attached, you'll be able to see that the latches on each side are completely engaged and the outer pad is fully attached to the moving portion of the instrument. The smart tip is made up of the outer pad with a flexible electrical connection, the inner pad, which is inserted behind the eyelid, and the shield portion, which keeps the light from reaching other parts of the eye. Once the smart tip is attached, its internal timer gives you about 1 hour before it expires, or about 15 minutes of warming time. With the smart tip attached, the home screen looks like this. As with the photo tip, you can access the gallery and settings menus and zoom in and out using the plus and minus icons from the home screen. Tapping the home screen turns on the camera along with the white light illumination ring. The screen will show the message "Capture Eyelid," indicating that you're ready to start the procedure. The compression control button moves the outer pad forward to apply pressure to the eyelid. On top of the compression button is the main switch, which we described previously in photo mode. The main switch has other functions when the smart tip is attached. There are two main modes with the smart tip: warming mode and expression mode. In warming mode, the main switch turns the warming lights on and off. In expression mode, the main switch takes photos and videos as it does in photo mode. To insert the inner pad behind the eyelid, have the patient look up while you pull down on the eyelid to create a gap. Slip the inner pad into the gap, being careful not to contact the cornea. Slowly lower the inner pad behind the eyelid until the margin of the eyelid contacts the two support arms of the smart tip. Take care not to bottom out on the periorbital bone. Press the compression control button until the outer pad contacts the eyelid and the display shows ready to warm. Note that the inner eyelid temperature is now displayed on the screen. Now slide the main switch forward to enable the warming lights. Note that, for safety reasons, the warming lights won't come on unless the outer pad is up against the eyelid. The image on the screen changes color as a result of the bright warming lights, which is normal. The eyelid temperature increases slowly. Once it reaches 38 degrees Celsius, which is the average melting point for meibum blockages, a melt timer starts counting up in seconds. As a general guideline, when the melt timer reaches 40 seconds, most meibum has melted. However, on some patients it melts sooner, so use clinical judgment on a case-by-case basis. Once the meibum is melted, slide the main switch back to turn off the warming lights. The screen will say shifting to expression. If you slide the main switch forward again within 3 seconds, you'll stay in warming mode. This helps prevent inadvertent mode changes. After 3 seconds of holding the main switch off, expression mode is initiated. To express the melted meibum, apply pressure to the eyelid using the compression control button while watching the eyelid margin. Sufficient pressure is applied when the eyelid margin is seen to bulge between the pads. Apply compression for 5 seconds, then relax slightly. A maximum of 4 compression cycles should be applied. To capture photos and videos while in warming and expression mode, the default setting is auto photo mode, in which a still photo is taken automatically at the start and end of warming mode, and a video is taken throughout expression mode. To turn off auto photo mode, go to the settings menu. After you've completed treating a zone, gently lift the inner pad up and out from behind the eyelid, taking care not to tug on the lid or to make contact with the cornea. Note that you can use the same smart tip to treat both uppers and lowers on both eyes on a single patient. The procedure for treating upper eyelids is similar to that for lower eyelids, with these differences. First, if the patient is sitting upright, invert the instrument. As you do this, the display on the screen will rotate to remain upright. To slip the inner pad under the upper eyelid, gently pinch or pull up on the lid to create a gap. Then slide the inner pad into the gap while having the patient look down. As before, avoid contact with the cornea and insert until the eyelid margin contacts the support arms. To turn off the unit, press and hold the power button until the screen goes black and the blue light around the button goes out. To preview the captured images on the device, go into gallery mode as described before. Once there, turning the instrument sideways shifts the images to full screen mode. You can zoom in and out, pan, and swipe left or right to scroll. To view the images on an external monitor, insert the instrument in the docking station and connect an HDMI cable to the monitor. Alternatively, you can connect a USB cable from the docking station to a computer and transfer files from the SD card in the instrument to the computer. You can also remove the SD card from the instrument and insert it into a computer to transfer files. For more details on image transfer and for troubleshooting any error conditions, please refer to the manual. Thank you for watching. We hope you enjoy using the iLux2 system.